everyone, today our topic is scapula. We have already studied clavicle in the last video. Today our topic is scapula. Scapula is called a shoulder blade in Latin, which is a thin bone placed on the posterior lateral aspect of the thoracic cage. Scapula is located in the posterior lateral aspect. Posterior means back, posterior lateral aspect of the thoracic cage. Lateral means away from the body, medial means towards the body. Away from the thoracic cage, that is lateral, and posterior means back side of the thoracic cage. The scapula has two surfaces, three borders, three angles and three processes. It has two surfaces, three processes, three angles, three borders. It has 2,333. For remembering purpose, I have told 2,333 is the number where it has two surfaces, three processes, three angles and three borders. We will study in the features. Now we will go and study the side determination. In side determination, we have three main points to remember the side determination, that is lateral or glenoid angle, which is large and bears the glenoid cavity. It has glenoid cavity which is large and it is lateral side, and it is the lateral aspect means away from the body, so it is now right scapula. And then the dorsal surface is convex and is divided by the triangular spine into supraspinous and infraspinous fossae. The dorsal surface is convex and is divided by the triangular spine into supraspinous fossa and infraspinous fossa. The costal surface is occupied by the concave subscapular fossa to fit on the convex chest wall. The costal surface means anterior surface. Costal means in the anatomy ribs area and means nearer to the ribs. For costal area it is concave, which helps to fit on the convex chest wall. Means chest wall is thoracic cage, that is in the convex shape, and this is in the concave shape, so that it can fix tightly. Tightly means for the moment fit, it can fit over there. Now the thickest lateral border means this is the thickest lateral border which runs from the glenoid cavity above to the inferior angle. From the glenoid cavity it runs to the inferior angle. This is inferior angle of the scapula. Inferior means downwards, superior means upwards. Supraspinous fossa, infraspinous fossa, which is divided by the spine of the scapula. Supra means up, infra means down, so that it is called a supraspinous fossa. Fossa means a depression, and infraspinous fossa, that is infra means down of the spine, that is infraspinous fossa. Now we will go to the features of scapula. Scapula has two surfaces. We have already discussed. It has two surfaces, that is costal surface and dorsal surface. Costal surface means anterior surface. Costal surface means anterior surface, and dorsal surface means posterior surface. For the understanding purpose, dorsal means back, anterior or costal means front. The costal surface or subscapular fossa. This is subscapular fossa is concave and directed medially and forwards. It is directed medially and forwards. It is marked by the three longitudinal ridges. Marked by the three longitudinal ridges. 1, 2 and 3 ridges are present over there, and another thick ridge adjoins the lateral border. Another thick ridge, this is thick ridge, adjoins the lateral border, This part of the bone is almost rod-like. This part of the bone is almost rod-like. It acts as a lever for the action of the serratus anterior in overhead abduction of the arm. Lever means it helps in the pulley. It like a pulley. Lever for the action of serratus anterior. Serratus anterior is the attachment in the posterior view. Overhead abduction means for this movement. Overhead abduction means this direction. The dorsal view. The dorsal view means posterior view or surface, dorsal surface. This one is dorsal surface. Gives attachment to the spine of the scapula. Gives the attachment to the spine of the scapula, which divides the surface into smaller supraspinous fossa and larger infraspinous fossa. It divides the spine into supraspinous fossa and infraspinous fossa. Fossa means depression. In the which surface? Dorsal surface. The two fossa are connected by the spinoglenoid notch, situated lateral to the root of the spine. It is situated in the lateral root of the spine, that is spinoglenoid notch, which connects the supraspinous fossa and infraspinous fossa, that is spinoglenoid notch. Spinoglenoid notch. Spinoglenoid notch. Now we move to the borders. It has three borders. They are superior border, lateral border and medial border. In the superior border, it is the shortest near the root of the coracoid process. Coracoid process is the process which is like finger-like projection. We have superior border, which is the shortest. It presents the suprascapular notch. It has suprascapular notch in it. This is called the suprascapular notch. Suprascapular notch in the superior angle. In the superior border. The lateral border is thick. At the upper end, it presents the infraglenoid tubercle. In the lateral border, it has infraglenoid tubercle. Tubercle means bumpy like shape like this. That is infraglenoid tubercle. In the upper end, the medial border is thin. It extends from the superior angle to the inferior angle. This is the superior angle and this is called inferior angle. From superior angle to inferior angle, the medial border exists. Angles. The superior angle is covered by trapezius. The superior angle is covered by trapezius muscle. Trapezius muscle will be over here. The inferior angle is covered by the latissimus dorsi. Latissimus dorsi will be over here. It moves forwards around the chest when the arm is abducted. The lateral or glenoid angle is broad and bears the glenoid cavity or fossa, which is directed forwards, laterally and slightly upwards. A supraglenoid tubercle is present above the glenoid cavity. Supraglenoid cavity is nothing but superior part of the glenoid cavity. Supraglenoid tubercle is present above the glenoid cavity. Supra means above. This is glenoid cavity. This is glenoid cavity. This one, and this is supra means above, and infra means below. That is supraglenoid tubercle, and this is infraglenoid tubercle. We move on to the processes. The spine or spinous process is a triangular plate of bone with 3 borders and 2 surfaces. Spinous processes have three borders and 2 surfaces. It divides the dorsal surface of the scapula into supraspinous and infraspinous fossa. Its posterior border is called the crest of the spine. This posterior surface is called the crest of the spine. The crest has upper and lower lips. It has upper lip and lower lip. The acromion process has 2 borders, medial and lateral. It has 2 borders, medial and lateral. 2 surfaces, superior surface and inferior surface, and a facet for the clavicle. It is the facet for the clavicle, which I have shown in the clavicle video, that is it attaches to the acromion process of the scapula. We have to relate the attachments, process, angles in the anatomy. It's very important. And then coracoid process. Coracoid means crow's beak in Greek, is directed forwards and slightly lateral. It is bent and finger like. I have said that is finger like and slightly lateral. It has an atavistic type of epiphysis. Epiphysis means end of the shaft. Attachments we will see in the next video. Thank you. Jai Hind.